Hey, good morning guys. My name is Hedi Jarmakani. We met on a previous video. I'm one of the chief radiology residents, and here we are outside the hospital, as you can see, Yale New Haven Health. And so today we're going to show you the ED department. We'll walk around, meet some staff, meet some faculty, look at the equipment we have, and see how close we are to the actual ED department and see how the workflow goes. So let's go. Here's the entrance to our ED department with badge access. So here's the Diagnostic Radiology department. And this is probably a good time to talk a little bit about call. So as a first year, you're on call with a senior. Whenever you're on call, you have weekday call and weekend call. You're pretty much on call from day one. So you'll come in and you'll have a buddy call who comes in with you, shows you the ropes, shows you how to protocol, walks you through some studies. And then after that, you really start taking call with a senior and with an attending there. So you're never on your own. People are always there to help, and it's a really good way to get your feet wet. And so you're really seeing the depth of trauma, community reading, pretty much everything. And you're overread by the attending on the spot right there, so learning opportunities happen right away. A very unique thing that we have that when I was interviewing, I was like, wow, this is awesome. We have someone who sits at the front desk who all the phones are sent to them. They're our triage person. That can be a moonlighting opportunity for a resident that can work, do some studying time, answer some phone calls, do some protocols, and get paid. Or we have med students that actually also get paid and do that job. There are 1 million calls in the ED, and if you're stuck answering all the phone calls, that's really less time you have dictating. So the triage thing is a godsend. It's really wonderful to have that. Let's take a walk around and I'll show you guys some of the rooms. So here we have ultrasound. Here's where our ultrasound techs hang out, and they have an ultrasound room here. When we're on ED, especially ED2 or ED senior, it's so close to the reading room. Here we come and we scan with the techs, and we do some scanning, ultrasound scanning ourselves. And then here is one of our fluoro rooms. So if we have any type of fluoro case, an esophagram, something like that come through the ED, here's where we come and do that study. Here's another x-ray room. Here are the CTs. There's 2 CT scanners going on at the same time. The techs and us are very close. They're just like a hallway's walk away from us. So if we have any issue, we come here, we talk to them, they call us. We come and we review the trauma scans with the trauma team at times. With the pediatric scans, we come and review them. The other day I came for a trauma case, saw there was a liver laceration, on the spot said we need delayed imaging. Got the delayed imaging, saw there wasn't any active extravasation, so very fulfilling thing to be able to come and do that right away and help out the techs. So let's, it's early, so they might be asleep, but let's walk in. Hey, good morning. All right, let's get out of here. Here's another area that I've come and scanned with the techs before, and as you can see, all this is in very close proximity, which makes it very convenient. And then right out this door is the ED. Whenever there's a trauma, they announce it overhead. And we're in the reading room, so obviously we can hear it. And they say trauma bay, whatever, and here are all the trauma bays. So we just literally walk out, come, put our eyes on the patient, and so we kind of get to see what brought them in and look at the external injuries, and that helps guide us better to produce a better report to help the clinicians. This way is the PEDS ED, and there have been a lot of times where I've come over here too as well to either consent to family, to do a GI study, to do an enema, whatever. The clinicians, both in the children's ED and the adult ED, expect us to come by, expect to have a working team relationship with us, which I think is very nice. Now let's go into the ED reading room. So like I said, this is where the ED triage person sits, kind of at the helm of everything. and they take all the phone calls here and disperse it back to the room. Over this way is the reading room, and we fit a lot of different people. We have the attending, we have the RA, we have the resident, sometimes more than one resident. Each person's got a specific job. And then we have our pull-up bar here, and if you miss a case, the rule is you do 10 pull-ups. That's actually not true, it's 20 pull-ups. So if you come here, you'll get your pull-up game strong. And let's meet everyone in the room.
So here's our ED reading room. There are 6 workstations in here. Additionally, we have a dedicated workstation for the VA packs because we do read the VA studies overnight. Currently, there's no one being scanned, but these 2 monitors up in the corner show the active scanning being done at the CT that we just saw. So if there's any trauma studies or anything that needs review, we don't have to walk over to the CT area. We can just look up and there they are. And reading today, we have Dr. Bakari, our program director.
Hello.
You want to tell us a little bit about yourself, how you got to Yale?
Well, I've been at Yale for close to 28 years now. I did my internship here, residency here, stayed on for fellowship here after serving 2 terms as chief resident at Yale, and have been attending since 2000, so it's almost 20 years of being an attending in the ER. I did celebrate after graduating from residency my last night shift, but then continued, and I'm still doing nights after 20 years of that celebration. And I think I found Yale to be a very, very collegial place, in addition obviously to be a center of excellence for learning radiology, and I couldn't be happier. It's extremely exciting. Obviously, working in radiology itself is extremely exciting. It's a matter of a joy coming into work every day, and in great part because I work with residents. I think that really adds to great value to my not only to my career, but to on a daily basis. They are the ones who keep me sharp and on my toes, and always learning and always staying up to date. And I think that as a highlight of my career, if you were to ask me, it is working with the residents. It is the absolute joy of seeing my own students exceed me. That is when I feel that I have really been successful in being a mentor and in training residents.
Great. And I guess as a final word, any advice for applicants, as program director, head of the selection committee, since they're going through the season virtually this year?
Yeah, absolutely. My first thing would be, don't be anxious. I know these are times which are different. These are hard times. Things are being differently. I would strongly recommend not being anxious. Get as much information about the programs you're visiting. Go online. Visit their sites, be engaged with the trainees of the program that you are visiting. That is the best source of information about any program, is to talk to and be engaged with the current trainees of the program and recently graduated trainees of any program. They are the ones who are really going to tell you not only what the quality of the program is, but also how your day-to-day life is going to be. After all, you're going to be there for 4 or 5 or 6 years, depending on whether you're DR, IR, and whether you do internal medicine or your preliminary year there. And it's a very significant part of your life, and you really want to be in a program which takes care of you, takes care of their residents, and is a place where you come into work with a sense of joy. And that you can only gather from the trainees of the program. So I would very strongly recommend that you engage with the trainees and get your information there.
Great, thank you. All right, we're going to keep moving along. So this is Grace. She's just finishing up her night shift in the ED.
Hi there.
You want to say hi and maybe talk about how the night shift is going and on the ED rotation?
So I'm a second year, and as second years here at Yale, we start our ED night shifts. I was lucky enough to be scheduled with our program director for the duration of this week, and I think into next week. And it's been going great. I'm lucky to work with him. He's one of the best. So I was a little nervous at first, but
She's not just saying that because he's right around the corner.
but no, it's really great opportunity for us to learn from the best. We actually start call our first year, and then we start doing overnights our second year. So great exposure. So it's been good.
And what things do you like about Yale? What attracted you to this program?
I think what attracted me is the people. I know it's going to be hard this year because you can't meet us, but when I met the residents, they were all happy, which is something that I, looked at. So I just love the people. For instance, I came in tonight as a newly minted second year. This is my first ED rotation, and there was a bad trauma that came in right at the beginning of my shift, and one of my upper year, he offered to stay to help me out. So it's just the collegiality here that I really love.
Nice. And any advice for applicants who are, applying virtually this year, don't get to see the campus or
Also,
the sites?
I do. One of my mentors when I was applying had really good advice, and his advice was a radiology department is only as good as the other subspecialties. So you really want to look at, when you are applying the other subspecialties at those programs. And here at Yale, we have amazing everything. We have exposure to neurosurgery, ENT, we're a trauma center, so we also get trauma here. We have great pathology. So I would just, look at the program itself and make sure that it's well-rounded, because all the other subspecialties are going to be feeding radiology, so you want to make sure that they're strong as well.
Great advice. Thank you.
Thank you.
We have a Tin here who's going to show us a little bit of our workstation, our PACS, and some of the AI software that we've started to incorporate into the ED workflow.
So we recently upgraded probably a year and a half ago our entire PAC system. As far as the EMR, we use Epic. For the viewer, we use Visage, one of few institutions in the country that have started using Visage, and we use Primordial as our list manager to manage what studies we'll be reading. We have also AI doc, artificial intelligence, incorporated into our clinical workflow, so not just for research, but for our daily practice. So for example, I'm looking at this pulmonary embolism study, CTA chest. Patient came with shortness of breath at a history of malignancy, so high concern for thrombus within the pulmonary arteries. And the cool thing about this PAC system is very light, and you can make reformats on the fly. So you can pull up anything here, you can see it in multiple planes. And the other thing to note is that once you see a study on the list, you'll see this AI monitor come up, which tells you that there's potential finding that the artificial intelligence software that's running in the background has found. So you can click on that study, and that's a higher priority study that you want to read. In addition, you have this icon here that you can go through and see all the cases that is running in the background and which the artificial intelligence software is scanning. So for example, in this case, you can scroll down, and basically you're looking for any clot or any difference in attenuation within the pulmonary arteries to see if there's a thrombus. And if you're really going fast at this case, it'll be very hard to see and potentially miss a pulmonary embolism, which really changes clinical management. So once you've gone through the case, there is a sequence here that you can pull up, gives you a screenshot where it thinks there's a pulmonary embolism. So if you missed it, you can go back and try to find it to see in the similar area. You can go here, so right there, we see it, matches it there. So now you've just diagnosed pulmonary embolism in the event that you missed it, or you saw it, but you saw the icon here, so you got it out earlier. And this works on CT chest. It also works on the CT head cases. So for example, in this case, so here, subtle intraventricular hemorrhage. You can see it very clearly. So it really helps you, prioritize cases. Helps you acts as a second reader in identifying subtle bleeds. So this is available for intracranial hemorrhages, cervical spine fractures, pulmonary embolism, or pulmonary nodules. And that's from the clinical side, fully integrated. We also do research with it. We've shown that using artificial intelligence has decreased turnaround times in the ER setting for studies and patient management. There's other ongoing research going on as well, which the residents, trainees, fellows, everyone's available to work with. But this also, this PACS system is so light that you can look at cases away from here through a VTN system that we have developed, so you can continue your learning.